August, President Biden announced a COVID vaccine mandate for all healthcare facilities nationwide that accept Medicare and Medicaid. A potential deadline on that is now looming. Also on the horizon is the presidential mandate that all companies with more than 100 workers require vaccination or weekly testing. And there's no timeline yet for when that's going to be implemented, but it's raising a lot of questions. You've seen us do lots of stories on people quitting their jobs. Here in Indiana, roughly 55% of all eligible Hoosiers are fully vaccinated. That means there's a lot that aren't. Joining me live is the White House Vaccinations Coordinator, Dr. Bashara Shukar. He's in town for a series of meetings with the governor's office, state public health leaders and doctors and hospital networks. Sorry, I got your name wrong. I had it all practiced right. Good to see you.
Good to see you too. Thank you so much for having me.
Absolutely. I want to start with you being able to basically give your side about these mandates. They're controversial. What do you want people to know, and why are you here in Indiana trying to talk to those to kind of help them understand where you come from?
Well, look, Angela, we know that vaccine requirements work. We've seen it over the last several weeks with literally hundreds of companies, universities, health systems adopting vaccine requirements, and that's making a difference. I mean, look at United Airlines, for example. Before the mandate, 59% of their employees were vaccinated. A couple of months later, it's 98%. Look at universities, University of Michigan, Rutgers, all over 95%. Active duty military from 76% to 94%. We know vaccine requirements work. They are the right thing to do, and we know the American public support vaccine requirements.
President Biden said in December that he would never require a mandate. Jen Psaki said, too, that it's not legal. She said that on television. What do you say, what changed that, and why is it now okay, after saying that, to now mandate it?
Well, look, I look at this country, and we've done a tremendous job. We have more than 212 million people with at least one shot. But we still have about 70 million people in this country who are eligible but hasn't gotten their vaccines yet. You've mentioned here in Indiana, only about 55% of those who are eligible are vaccinated. So we still have a lot more work to do, and we have to get more people vaccinated, which means we have to use all the tools in our toolbox. We have to talk one-on-one with people, answer people's questions. We have to make sure that people are getting a chance to talk to their doctors. We want to make sure there are incentives in place for those who would like an incentive to get vaccinated. And for some people, we know that they're waiting for their employers to tell them, we'd want you to get vaccinated. So we have to use all the tools in our toolbox to get more of this country vaccinated.
What do you think is stopping most people? What is the fear? Or is it more of a fear and not understanding of vaccines? Or is it more of someone doesn't like to be told what to do you think?
Well, I mean, the way I look at it, Angela, is the group of people who are not vaccinated yet is not a homogeneous group. There are different things that work for different people, but we have to also be very realistic here. There's still a lot of people who have a lot of legitimate questions about the vaccines, and we have to make sure they're getting answers, they're getting facts, as opposed to a lot of the misinformation that we're seeing out there. That's why conversations with doctors are so important. I spent the evening last night with a group of family doctors and a group of pediatricians talking about the role of the doctors in making sure that people are getting answers, are getting facts, so that they can make their own informed decision.
I think one of the biggest questions, there are millions of people who believe or have been told they've had their antibodies tested. They have natural immunity. We know that antibodies are used to make therapies. There are lawsuits happening right now with people who have natural immunity. Dr. Fauci has said that they are studying natural immunity. Do you think it's fair to make someone who has natural immunity, who shows they have antibodies, to make them mandated to be able to actually keep a job? Maybe a woman who's pregnant that's had a miscarriage that is concerned about having a vaccine?
Well, first of all, I think it's important to realize that natural immunity does give you protection, some protection against the disease. We know that. There's studies that have proven that. What we don't know is the durability of the protection that you get from natural immunity.
Let me stop you right there, because also we know that vaccines, same thing happens. So if somebody got a vaccine a few months ago, their durability, that could wane. So why is it then okay? This is what I'm hearing from half the viewers that are saying, then why is it mandated for me, not them, or them and not me, when the same thing would happen to someone who has a vaccine?
Well, we have to continue to be very close to the data. We have to continue to follow the science, and that's what Dr. Fauci has said. We have to continue to track this, get a better understanding about the durability of the protection that you get. And what we also know is that if you have natural immunity and you get the vaccine, that significantly boosts your protection against any future infections, about any potential variants that might come up. So it's really important that people who've been infected to still get the vaccine so that they can boost their immune system even better.
We appreciate you coming in and being in Indiana, talking to people and answering questions, because like you said, the more information that our viewers have is going to help them make that decision and hopefully get you where you guys want to be. Good to see you.